Hi everyone, Dr. Lindner. Okay, let's take a look at some more anatomy of the respiratory tract. So from an external or superficial perspective, number one right here, this is going to be the root. And then number two, this would be the apex. And number three, this is the bridge of the nose. And number four is the external nares. We've seen the internal nares before, but here's the external nares. And again, the external portion of the nose is made of cartilage and skin, and it's lined with mucous membranes. So here's the cartilaginous framework. There is a lateral nasal cartilage, and in the center, we have the septal nasal cartilage. Sometimes people will say, oh, they have a deviated septum. That's right here in the center. And then we have these minor and major alar cartilages. And then we have some dense fibrous connective tissue here with some fat cells or adipocytes or adipose tissue. Again, if we look at the bony framework of the nose, it's formed from the frontal bone, the nasal bone, and maxillary bones. Here's our frontal sinus. Here's our frontal bone. Here's the olfactory epithelium. Here's our nasal bone. Here are the nasal concha, also known as the nasal turbinates, and they're the inferior, middle, and superior. Again, that's going to spin, centrifuge, and moisten the air. Right in the entrance, that's the nasal vestibule. If we go external to that, more superficial, that's the external nares. The internal nares is here, near the nasopharynx. Here's the sphenoidal sinus, which is just under where the pituitary gland would be. We've already showed you the frontal sinus. Now, between the inferior, middle, and superior turbinate, or inferior, middle, and superior concha, are the nasal meatises, inferior, middle, and superior meatus. Okay. Behind the nasopharynx, this is the opening of the eustachian tube or the auditory tube. Here's the maxilla. That's the maxillary bone, right? Here's the palatine bone right here. That's the palatine bone. And behind the palatine bone is the soft palate. And posterior to the soft palate is the uvula. That's when you open your mouth, you say, ah, the uvula should go center and it should go straight up. We often look at cranial nerve 9 and 10 damage, especially post-stroke. If there's cranial nerve 9 or 10 damage, you'll get this deviation of the uvula to one side or the other, or you won't see the musculature of that palate rise symmetrically. One stays down and one goes up. So good clinical information there for you. Here's the oropharynx. Here's the epiglottis. And here's the laryngopharynx. Here's the larynx. Here's the vestibular fold, the one on top. That's the false vocal fold. And then here is the vocal fold, which is the true vocal fold. And that's the one that's going to be able to make vocal sounds, the one that actually makes the tone of your voice. That is the true vocal fold. Okay. You have your thyroid cartilage, which is the Adam's apple, and then you have the cricoid cartilage. Remember, the cricoid cartilage is the only one that goes all the way around the trachea, which is why we see it in the front, and we see the cricoid also in the back. That's not true with the thyroid cartilage. We can only see it from the anterior. We do not see it wrapping around the posterior. Here's the epiglottis, which remember folds down. When the epiglottis folds down, it helps divert food that you're eating to go down the esophagus so that it doesn't get trapped in the windpipe or the trachea, which we see right here. That's the trachea, and posterior to it is the esophagus. Here from this view, we can see the superior nasal concha, the superior meatus, the middle concha, the middle meatus, and then the inferior concha and inferior meatus. Now, from this view, when you're looking at the person from the front, we could see the maxillary sinus, but here, this is the inferior nasal concha, the middle nasal concha, and the superior nasal concha. Now, from this view, when you inhale air, you can see the spirals. You could see the turbine. That's why sometimes they're called turbinates or concha, like the shell concha, how it has many of those spirals, and it spins and centrifuges the air as we breathe it in. The pharynx is the passageway for air and food. It provides the resonating chamber for speech sound, and it houses our tonsils, which is going to participate in the immunological reactions against any type of foreign invaders. Again, color-coded: nasopharynx, oropharynx, and laryngopharynx. Looking at the larynx, or the voice box, this is a passageway that connects the pharynx and the trachea. Some key landmarks here. Here's the hyoid bone, the only bone in the body that doesn't articulate with any other bone. On the left side, this is the anterior view, and on the right is our posterior view, just to kind of get your orientation. So here is the epiglottis. You could see that really from the posterior view, but from the anterior view, you could see just the tip of it right there. Here's the thyroid cartilage, which is the Adam's apple. More prominent in men because men have higher amounts of testosterone, so we'll be able to see the laryngeal prominence, which is right here, stick out a little bit more in men than in women. Don't confuse the thyroid cartilage with the thyroid gland. Here's the cricoid cartilage. Cricoid means ring, so we can see it around the anterior and we can see it around the posterior. Whereas the tracheal cartilages, or the tracheal rings that are called C rings, they go around the anterior, but you could see in the posterior, they do not complete a ring. They don't completely close off to create a ring like the cricoids do. They stay opened in the posterior. From the lateral view, here's the epiglottis, here's the hyoid bone. And now from this view, we can see the vestibular fold right here, and we can see the vocal fold right here. So it's this vocal fold, which is the true one that's involved in producing sound, or the voice. Here is the cricoid. So you can see it from the anterior and the posterior because it makes a complete ring. The C cartilage, or the tracheal rings, do not close off on the posterior. The true vocal folds consist of cartilage, skeletal muscle, and mucous membrane. The true vocal fold is responsible for the production of the vocal sounds. The false ones are these flaps of tissue that helps to support and stabilize the true vocal folds, and they're more important in directing the flow of air through. So here are the vocal ligaments of the true vocal folds right here. And you can see that they do attach to the arytenoid cartilage. And there is musculature if you look off to the right here. And you could see when these muscles contract and these muscles contract here, it changes the orientation of the true vocal folds. So when it's held together, right, think of a balloon. When the balloon is filled up and you pull the tip and it's held together, it makes a high-pitched sound. But over here, like if you really open it up, right, the balloon makes a lower pitch sound. So depending on how the air is passing through these, you can have high pitch or low pitch. Again, you can look at the different orientation of the arytenoid and the corniculate ligaments, how they change in their direction, which certainly alter the shape and direction of the true vocal folds. And you could see down below what it really looks like. Here's the true vocal folds on the left, and you could see them on the right. And here you could see the glottis on the left, and here on the right, it is wide open. Okay, and then you could see the cuneiform and the corniculate cartilages here, which are the same of what we see kind of like up here. Here it's just bony. Here you can see the soft tissue covering it. And again, just another view showing the posterior cricoarytenoid muscle here. And then you have the lateral cricoarytenoid muscles here, and they alter and change the shape of the vocal folds and how rapidly they can contract against one another. So only the true vocal folds actually produce the voice sound, and the false vocal folds exist along the sides of the true vocal folds, and they help really to direct the exhaled air during speech through the opening between the true vocal folds. So during speech, the true vocal folds are brought together by those muscles that I showed you before. As speech begins, air is exhaled against the closed vocal folds. When the exhaled air separates, the true vocal cords are brought together by muscles. And as speech begins, the air is exhaled against the closed vocal folds. When the exhaled air separates the true vocal folds, they begin to vibrate, and they create the voice sound. The volume and pitch of the voice could be altered by varying the degree of the contraction of the muscles causing the true vocal cords to close. If the muscles controlling the closure of the true vocal folds contract forcefully, the tension on the true vocal folds increase, and the pressure of the exhaled air must be increased in order to separate the true vocal folds and initiate the vibration required to produce the sound. And the vocal folds will vibrate rapidly and create the voice sound with a much higher pitch. If, however, the muscles controlling the closure of the true vocal folds do not contract forcefully, the true vocal folds will not close tightly, and the small amount of air pressure will begin to separate them. This situation will cause the true vocal fold to vibrate slowly and create a voice sound with a lower pitch. The voice sounds are also affected by hormones and the shape of the sinuses, the skull, and the nose. You can have low or high, and it's also controlled by sympathetic tone, right? When you're under stress, the sympathetics can tighten up, and you can get the tightening of those vocal folds, and that's why when you get into an argument, sometimes the voice gets higher. Okay, we'll take a break, we'll come back, and then we'll look at the trachea a little bit more detail.